Working as a registered nurse full-time in the height of the pandemic was definitely very difficult. I'm Alexis, and I'm a registered nurse. I think something that put things into perspective for me in a different light was when my dad got sick during the pandemic, because I was seeing what patients were going through being in the hospital. They were by themselves and they were alone, and things were a lot less personal than we would have liked them to be. He spent the last weeks to months of his life in the hospital, and just knowing what it probably was like for him to spend the rest of his life alone and isolated and probably scared, I think it made me a different and a better nurse because I care for people in a different way. Even though Lansing is a very populated area, we definitely have lots of rural communities that are surrounding us. And we know that people in these communities have greater prevalence of heart disease and lung problems. This makes them more susceptible to getting COVID and also the complications of COVID. A lot of people say that you should get vaccinated because of the people around you. It's not just about you, but it's about your community. And I think even if you don't feel that way, really you should think about yourself. We never know when things are going to happen to us that's going to require us to be in the hospital. And if that happens and we're in the height of a pandemic and there's a lot of patients in because of COVID, our doctors, our nurses, they're not going to have the resources, the supplies, the equipment to take care of us or our families the way we would want them to be taken care of. Really, getting vaccinated, it is for those around you, but it's for yourself as well, because you never know when you're going to need medical care, and when you do, you're going to want the best medical care possible. We hear things from people around us or on social media, and it's really hard to figure out what's fact and what's false. The decision to get vaccinated should be between you and your healthcare provider. They know about you the best. They know your underlying conditions, your past medical history. If they are recommending the vaccine to you, it is because it will benefit you and keep you healthy. Being fully vaccinated for COVID means that you're not just getting your first vaccine, but you're getting your second one. Getting boosters is very important as well. We now have boosters that are specific to the variant that is going around, so that's very protective. By getting the booster, you are reducing your risk of being hospitalized, which is the most important thing, because we don't want our hospital systems to get overwhelmed how they were before. And you're also reducing your risk of severe illness and death, and you're decreasing the spread of transmission as well. I would say that when vaccines came out, it really changed the game, and that's what got us out of the bad parts of the pandemic. But it's important to remember that we're still in it, and it's not over yet. So getting vaccinated is really the way that we can get ourselves out and move forward.